Dr. Kalenga, Mwewa Martinho, Obstetrician and Gynaecologist practicing at Buchilo Private Hospital here in Soshanguve. I'm going to talk about antenatal care. It is basically the management of pregnant women aimed at decreasing the rate of poor obstetric or pregnancy outcome by identifying conditions which may affect the fetus and the mother, educating them about the birthing process, and also the puerperium, the period after they have delivered. Ideally, a pregnancy should be planned, meaning a person before they conceive must consult for being educated and do the risk assessment so that she is categorized before she can become pregnant. Identify conditions which are pre-existing, treat them and cure them, those ones which are curable, and then the ones which are not curable, control them, and then give some supplements such as folic acid to the patient, and then give them the green light to can try and conceive. From the time they miss their menses, then they should consult to confirm if they are pregnant and locate the pregnancy and also date the pregnancy. Thereafter, review the risk assessment of the patient, and if correct whatever is there to be corrected and treat, and then they should be seen according to their risk profile. But normally, if there is none, it's monthly. There are important obstetric milestones. Before the end of the first trimester, there are blood tests and screening which have to be done. We check how much blood the patient has, the blood group. We check for infections, hepatitis, rubella, HIV, syphilis. And on the first trimester screening, we screen for aneuploidy, meaning the trisomy 13, 18, and 21. And that's in conjunction with the scan, and then assess the risk for such abnormality. Thereafter, the second trimester, during the second trimester, starting from 15 to 20 weeks, 6 days, we do also the second trimester screening, whereby then we do again the blood test and review the first trimester result, second trimester result, and make the risk assessment for the patient. There is also the anomaly screening, which occurs between 18 and 24 weeks. There we assess the anatomy of the patient or the fetus, go the detailed anatomy scan. Other important milestones is the quickening, which is the subjective perception of fetal movement, which often occurs between 18 and 20 weeks in patients who are pregnant for the first time, and a bit earlier than that, 16 to 18 weeks in patients who have delivered before. Thereafter, then at every visit, we review the risk of the patient and manage them accordingly. We also educate the patient about the birthing process, pain management, how to handle, to manage the labor pain, and also the birthing method, and the contraceptives after they've delivered. We talk about that during that moment as we see them regularly. There are only two types of delivery. It's either it's a cesarean section or normal vaginal delivery. Normal vaginal delivery ideally is the best, but it's not always feasible. A Caesar is done for obstetric indication. What is labor? Labor is basically a painful physiological process characterized by low abdominal pain, which radiates to the back, increasing in frequency and intensity, associated with cervical changes. By that we mean cervical dilatation and effacement, or effacement and dilatation, and also the descent of the presenting part. Labor is characterized or is divided into 4 stages, phases. We have the first stage of labor, which starts with the onset of labor up to the moment where the cervix is fully dilated, and the second stage is bearing down, which culminates in the delivery of the baby. And then we have the third stage, delivery of the placenta, and then the fourth stage. Of all these stages, the most critical or the most busiest stage is the second stage, whereby really the person who's conducting the delivery will be hands-on till the baby is delivered. But unfortunately, sometimes after the baby is delivered, people think it's over, then they can relax. While the fourth stage is very, very critical, because if you sneeze, you may end up losing the patient with bleeding. Hence, it is important to initiate breastfeeding immediately after the baby is delivered, as that also assists with the uterine contraction. There are also medications which you give oxytocin. First of all, we start with the active management of the third stage of labor, the delivery of the placenta, administering the oxytocin, and then delivering the placenta, and then assist with initiating breastfeeding, and that then will lead to the uterus contraction, minimizing the bleeding. Thereafter, it's monitoring the patient for about an hour. If everything is okay, then she can be transferred to the postpartum wards. Contraceptives has been already discussed during the antenatal moment. After the patient is has delivered, then we re-emphasize again. As a rule of thumb, a person who delivers and who's breastfeeding cannot use combined oral contraceptive for at least the first 6 months to avoid deep vein thrombosis, but they can use progesterone-containing contraceptives only. Of those, you can have the mini pills, you can have the implanon, you can have the injectables and others. In brief, antenatal care is very important to optimize the pregnancy outcome by assessing the risk factor, attending to the problems which are existing, and be on the lookout for others which can arise as the pregnancy progresses. And with this, we can say it is important for every woman to attend, and so that there is no surprises on the outcome. We thank you.